lecture series. Today we're talking about a syndrome called MERS, M-E-R-S, which stands for Middle East Respiratory Syndrome. A lot of my students want to know about this syndrome. And of course, it was discovered a couple of years ago in the Middle East. This is a syndrome that's caused by one of the coronaviruses, or maybe more than one of the coronaviruses. It's primarily found in the Middle East. But because of travel, there's been cases, especially in the European region, and now recently in the Republic of South Korea, there's been problems with resurfacing of the virus, and there's a concern that it could get, of course, to the United States. So viruses in the coronaviral family cause a multitude of different infections, from the common cold all the way to a syndrome called SARS, or severe adult respiratory distress syndrome, which is especially a problem in China than it was a couple of years ago. So this syndrome was first reported in Jordan, and unfortunately most of the countries in the Middle East have a problem with it. This virus is transmitted through close contact of an infected individual, or caring for an infected individual, or traveling in the area where there's been problems. Interestingly, having contact with camels, drinking camel milk or urine, or eating camel meat has been highly associated. And interestingly also, there's some studies that show that bats have been carrying this virus for years. Symptoms are pretty much typical of a respiratory syndrome: shortness of breath, cough, coryzal symptoms, fever, and then ongoing problems with diarrhea, nausea, vomiting, and pulmonary infiltrates and significant respiratory distress. The problem with MERS is that a lot of people are dying with MERS. About 30% of patients with MERS have died so far. So if you suspect a case of MERS, somebody's traveled to that area or has been involved with some other person that has MERS, and they come down with a syndrome, you should think about PCR testing of respiratory samples or serology sent to the CDC or to your state health department. Unfortunately, there's no antiviral agent currently that's effective for the coronavirus that causes MERS. It's just going to be supportive care, and hope that the person gets through the illness. From an infection control standpoint, good hand washing, covering the nose and the mouth when coughing or sneezing, and avoiding, obviously, bodily fluids. All very important. Bottom line is, it appears in the Middle East, at least, camels are an important source of exposure to MERS. And there's been hundreds and hundreds of cases that have been reported, probably underreported, and a high death rate related to MERS. So this gives you just a little input on where we're at with MERS. We might see a bigger problem with it in the near future. So Dr. Goldberg signing off.